Good morning, and thank you for joining this webinar on serving more children with disabilities in California state preschool programs. Please note that children with exceptional needs are also known as children with disabilities. You'll see this term used interchangeably throughout this presentation. The language in the management bulletin refers to children with exceptional needs to align with the statutory definition and education code. However, to align more closely with the federal special education law on programs, the California Department of Education encourages contractors to use the term children with disabilities at the local level during implementation. This webinar is being presented by the California Department of Education with three different divisions presenting today. We have Early Education Division, Fiscal Administrative Service Division, and our Special Education Division. This webinar is being held on February 10th, 2023, and is scheduled to run from 10 a.m. until 11:30 a.m. The management bulletin was released yesterday, February 9th, and it includes 1, the management bulletin, and 2, a diagram on enrolling children with exceptional needs with the set aside reserve. After the webinar, we will be working on FAQs and we'll be posting those on our contractor page, which we will put in the chat. https://www.cde.ca.gov. Oh, sorry, I'm supposed to spell it completely out. Let me start over for that. https://www.cde.ca.gov/sp/cd/ci/. And with that, I would like to welcome Stephen Profner, Director of the Early Education.
Wonderful. Thanks, Angela. Good morning and happy Friday, everybody. Welcome to the webinar. This morning, we're going to go through, as Angela mentioned, through guidance from the Management Bulletin regarding serving children with disabilities in the California State Preschool Program. If you haven't seen it, it got posted yesterday. This policy change is momentous for California and for California's children. Having reserved spaces for children with disabilities and actually having them funded from the start is really unprecedented, and it elevates a key value around inclusion of all children in early education and moves a research finding into our programs that all children are better off when children with disabilities are included in early education programs. I want to take a moment to appreciate all of you, our teachers and our administrators in our programs as implementers of these changes. So again, this is a big change and we're going to work through this together. I also want to acknowledge the CDE team that worked on this, led by our colleague on here, Jennifer, and supported by a broad team in the Early Education Division and enhanced with our friends in the Fiscal and Administrative Services Division and the Special Education Division. It takes all of us leaning in together to do this right, as well as our many other policies. And as this is a new policy, we know many of you will naturally have questions and require additional guidance to address nuances or other pieces that may not be in the guidance at the moment. As we've looked at our data on programs that enroll children with disabilities, this is a space we're growing into. Many of us are growing into. So we're going to do our best to get answers to all of your questions, but need to acknowledge that there are some that we'll need to take back to work on. So we'll appreciate grace as we give grace. And so I think I'll close out here. Just say happy Friday again. Thank you, team. And I'm going to hand back to Angela.
Thank you, Steve. So just want to note that we have over 1,000 people attending this webinar today. So thank you, everyone who just jumped on. Just to let you know, it is being recorded and will be posted. I'm Angela Data, and I'm an education program consultant in the director's office here at the Early Education Division, and I'll be your moderator today. To help answer your questions and to make this webinar run smoothly, we have a great team here with us today. From our policy office, Virginia, Eddie, Patricia, Jennifer, Danielle, Amira, and Mai. From the Inclusion Support Office, we have Kim, Nadia, Kim McMillan. We have two Kims in our Inclusion Support Office, Kim McMillan and Kim Nguyen and Nadia. From the Program Quality Implementation Office, we have Linda, Sandra, and Cassandra. From Applied Data Research and Evaluation Office, we have Jane and Carly. And from the Universal Pre-Kindergarten Office, we have Kate. Also from the Director's Office, we have Ariel. And from our other divisions at the CDE, we have Early Education, Nutrition, and Physical Service, Carly, Yashima, Alan, Kate, and Joey. From the Special Education Division, we also have Katie. To turn on closed captioning, you click on the CC button to the right of your screen. Our team is committed to being as responsive as possible, and we will not be able to answer every question. Just a reminder, our chat box is disabled. CDE will be able to share links with you there. But you are unable to chat with us. Please utilize the Q&A feature to ask any questions, and you'll see that right next to the chat feature on your screen. And now I'm going to turn it over to Virginia.
Thanks so much, everyone. And so happy to be with all of you today. For those of you who don't know me, I'm Virginia Early. I'm the administrator of our Early Education Division's Policy Office. So before we dive into the specifics of this management bulletin, we really wanted to highlight and lift up how this management bulletin is part of a holistic approach for California's schools and education more broadly. What we're doing right now in this moment in time is we are transforming how education works. We are transforming our education system in California to meet the needs of all children and set them up for success in learning in life. And so we really like to remind folks that this is integrated with a lot of other parts that are all happening at once. Universal pre-K, community schools, more around professional learning, anti-bias education, mental health programs, expanded learning, and universal meals. And these investments are really creating us the opportunity to come out of the pandemic, creating more inclusive and supportive learning environments for children. And we really are so excited about seizing the opportunities we've been given to create a bright future for our children and families. Next slide. So what is UPK? At this point, we think a lot of people sort of know, but we're going to be talking specifically about one piece of UPK today, but we want this focus on how do we increase inclusion is really something that we're working on across all of UPK. So I wanted to just create the framing and remind everyone how this fits in. UPK is bringing together transitional kindergarten, or TK, which is in the process of expanding, and all of the existing state preschool, like California State Preschool Program, or CSPP, which we're going to be focusing on today, federal Head Start, and private childcare, expanded learning opportunities, before and after school programs into the same system. And so what you'll see is that, Head Start, for example, has had requirements around inclusion for many years. And so state preschool is sort of moving in that direction as well. And how do we, as part of UPK, work to expand our opportunities, our inclusive opportunities for children with disabilities in California? So next slide. So going more specifically into that yellow bubble part of UPK, the state preschool part, which is where we're going to spend the rest of our time today, we wanted to briefly give you a visual of how this is going to roll out in terms of a timeline. So first of all, this fiscal year, so 2022-23, contractors must set aside 5% of funded enrollment for children with disabilities. That's what CWD is. As Angela mentioned earlier, we're using that term sort of synonymously with children with exceptional needs, although children with exceptional needs is the specific term from statute. We're going to be starting initial monitoring and technical assistance. We've published the management bulletin yesterday, which includes all of the changes that state preschool contractors will be implementing, and we'll be collecting data in September 2023 that you'll hear more about later. So, and you can see those sort of steps. We published the management bulletin early 2023, and that SNAP survey, and that's just a mechanism. It's our survey instrument's name, will be September 2023. In 2023-24, the set aside, so starting in July, the set aside increases to 7.5%. And so under the governor's budget proposal, they're appropriating money to cover the cost of additional adjustment factors for children with disabilities, the increased number of children with disabilities expected to be served. And then in 2024-25, the set aside increases to 10% for children with disabilities and remains at 10%. And the additional piece here is that programs that are required to set aside the funds and also are required to fill the set aside. However, if the set aside is not filled, there are no penalties. By July 2026, CDE is required to implement a process for LEAs that are not meeting the set aside to be able to apply for a waiver for meeting the set aside. And if the waiver, if they apply for a waiver, there's going to be more, we'll come out with more information on that well in advance of July 2026, but just sort of so you can see the implementation timeline there. So with that, I'm going to now pass it on to Kim to go deeper into our management bulletin.
Thank you, Virginia. As Virginia mentioned, the CDE just released a management bulletin on all changes to CSPP related to children with exceptional needs. The management bulletin includes guidance on the following. 1, change to the definition of children with exceptional needs. 2, categorical eligibility. 3, prioritizing and enrolling children with exceptional needs. 4, enrollment set aside and reserving space for children with exceptional needs. 5, the increased adjustment factor for children with exceptional needs and severe disabilities. 6, new data collection requirements for contractors. And 7, children with exceptional needs being educated in the least restrictive environment, also known as LRE. Next slide, please. Here is the definition of children with exceptional needs. Children with active individualized family service plan, or IFSPs, and receiving early intervention services, or children with active individualized education programs, or IEPs, and receiving early intervention services or appropriate special education. If a child meets this definition, then the child can be counted towards the set aside and can receive the adjustment factor. Just a reminder again, please note that children with exceptional needs are also known as children with disabilities. The language in this management bulletin refers to children with exceptional needs to align with the statutory definition in education code. However, to align more closely with federal special education law and programs, the CDE encourages contractors to use the term children with disabilities at the local level during implementation. Next slide, please. All CSP contractors must keep a family data file for each family enrolled in CSPP. The family data file must include documentation of the child's exceptional needs. This documentation must include a copy of the portion of the active individual family services plan, IFSP, or individualized education program, IEP, with the information specified in Education Code 56026 and California Code of Regulations, Title 5, 3030 and 3031, including but not limited to eligibility for the IFSP or IEP, instructional goals or measurable outcomes, special education or specific services, and parent consent for services. The first three items are available on the IEP at a glance. The CDE is in the process of updating the confidential application for child development services and certification of eligibility, Form ELCD 9600. Contractors must develop and implement a written policy to inform families of the family's obligation to provide up-to-date copies of the IFSP or the IEP, as well as any changes to the status of the IEP or IFSP. Please note the updated definition of children with exceptional needs struck the requirement for a child to require special attention from an adult in order to be considered a child with exceptional needs. This means that the additional documentation previously required to document that a child requires special attention of an adult pursuant to Title V CCR 17770B is no longer necessary to receive the adjustment factor for children with exceptional needs or severe disabilities. I'm now going to hand it over to Nadia.
Thank you, Kim. For a little more clarity on when a child is transitioning from an individualized family service plan or an IFSP to an individualized education program or an IEP, that child would count towards this required set aside. This child does count toward the set aside until their IEP appointment. If the child qualifies for an IEP, the child continues to count towards the set aside. If the child does not qualify for an IEP, then the child no longer counts toward the set aside. This change in status would have to be updated in the 801A to reflect the new status, since the 801A will be used to determine the number of children with exceptional needs currently enrolled in CSPP per contractor. Next slide, please. A child without an IFSP already enrolled in CSPP referred for special education assessment does not count towards the set aside and will not receive the adjustment factor. Contractors must develop and implement a written policy to inform families of the family's obligation to provide up-to-date copies of the IFSP or the IEP, as well as any changes to the status of the IFSP or the IEP. The IDEA requires IFSPs and IEPs to be reviewed periodically, but not less than semi-annually for IFSPs and annually for IEPs. If an IFSP or an IEP is not current and the family has not provided an updated copy of the active IFSP or IEP or information regarding transitioning from an IFSP to an IEP or the status of the annual IEP meeting as applicable, contractors cannot count these children towards a set aside, nor claim the exceptional needs adjustment factor for these children. However, if a family later provides an updated copy of the IFSP or IEP, the contractor may revise their fiscal reports to count that child towards a set aside and claim the exceptional needs adjustment factor during the time corresponding with the active IFSP or IEP. Contractors shall keep case notes in the family data file about the status of children being counted towards a set aside and receiving the exceptional needs adjustment factor if the IFSP or IEP documentation alone is not sufficient to show the exceptional needs status. Next slide, please. All right, CSPP enrollment now has categorical eligibility for children with exceptional needs. Children with exceptional needs do not have to qualify with income eligibility or another eligibility category. Families should still self-certify their income in order to enroll the children meeting income eligibility first. For full-day CSPP, families must self-certify their income to determine priorities for enrollment and for assessment of a family fee. Families must still establish a need for services. However, after all eligible families meeting the need criteria have been enrolled, a contractor may enroll families not meeting this criteria. Only the children in the family who are children with exceptional needs may be enrolled under the eligibility criteria of a child with exceptional needs. Any other child in the family without exceptional needs may be enrolled based on, based on any other eligibility categories. These include current aid recipient, income eligible, experiencing homelessness, receiving child protective services, or at risk thereof. And now I'm going to pass it off to Jennifer.
Thank you so much, Nadia. Good morning, everyone. As Angela mentioned, we have 1,000 attendees today, and so we are capped, unfortunately. So if you have any colleagues that are trying to get in, it is capped, but know that we are recording this session and we will post the slides and the recording, and we will also be hosting office hours related to this management bulletin. So that will come out soon. All right, so this slide. Family fees. All contractors must assess a family fee for families qualifying for full-day CSPP. All families are required to self-certify their income. Families can provide income documentation instead, but at a minimum, must self-certify their income. And as a reminder, family fees are waived for all families through June 30th, 2023. Next slide. For children with exceptional needs who are placed in the CSPP pursuant to an IEP, no fees shall be collected from the family to ensure the children with disabilities are provided a free, appropriate public education, or FAPE. Any family fee shall be paid by the local educational agency, or LEA, placing the child with exceptional needs in the CSPP. Because the LEA placing the student with disabilities in the CSPP is responsible for providing the student with disabilities with a FAPE. Next slide. If a child's status of being a child with exceptional needs changes during their 24-month eligibility period, the family is not required to provide additional eligibility documentation nor recertify early. Only at the time of recertification will the family be required to provide new documentation to establish eligibility. For full day, 24 months means 24 months from the date of certification, plus the end of the next program year if the child is still age eligible. For part day, 24 months means the current program year and the next program year. It's important to note that while eligibility for the program is not required to be updated, once a child is no longer classified as a child with exceptional needs, then that child does not count in the required set-aside of funded enrollment, and the exceptional needs adjustment factor cannot be used for that child. For more information about 24-month eligibility, contractors should refer to the Management Bulletin on Eligibility and Priority, MB 2301. Next slide, thank you. All CSPP contractors must set aside and reserve a percentage of their funded enrollment for both part day and full day for children with exceptional needs, which is 5% for 2022-23. Only children with exceptional needs, as defined earlier, may be enrolled in the set-aside. Children with exceptional needs from families with incomes above the income eligibility threshold shall not count towards the 10% limit of families in the income eligibility threshold. As the table depicts, this school year, at least 5% of the CSPP contracting agency's funded enrollment for both part day and full day must be reserved for children with exceptional needs. These slots must be held and only filled by children with exceptional needs. The set-aside increases to 7.5% next fiscal year, 22-23, and then starting in 2024-25 remains at 10% of funded enrollment, when contractors must reserve and serve children with exceptional needs. Next slide. Within the set-aside of funded enrollment, contractors are not required to follow priority order as it applies to the rest of their contract. So within the set-aside, they do not have to follow priority order. Contractors are required to enroll children with exceptional needs from families with the lowest income according to the income ranking table first. If two families with children with exceptional needs have the same income ranking, the child who has been on the waiting list the longest shall be enrolled first. Children with exceptional needs from families with income above the income eligibility threshold, as I said on the previous slide, do not count towards the 10% limit of families above the income eligibility threshold. And I'm going to turn it over to Amira.
Okay, this slide has a diagram showing how to enroll children with exceptional needs. The contractor sets aside their funded enrollment for children with exceptional needs, which for 2022-23 is 5%. If the set aside is not filled, then the contractor enrolls the child with exceptional needs, lowest income first. The set aside may include families that are above income, but families with the lowest income must be enrolled first. If the set aside is filled, then the contractor looks at enrollment priorities to determine which additional children with exceptional needs can be enrolled first. A long description of this diagram can be found at the end of the PowerPoint and will be posted when we post these slides. Next slide, please. Okay. Contractors must set aside a percentage of their funded enrollment for children with exceptional needs. After that set aside is filled, children with exceptional needs from families with income below the eligibility threshold get second priority. Children with exceptional needs from families with incomes up to 15% above the eligibility threshold get fifth priority. And children with exceptional needs from families at higher incomes do not get priority. As a reminder, children with exceptional needs from families with incomes above the income eligibility threshold do not count towards the 10% limit on enrollment of families above the income eligibility thresholds. All right, next slide, please.
Thank you, Amira. Now we will move into monitoring and technical assistance. To monitor the set aside, consultants from the Program Quality Implementation Office, PQI, will receive quarterly reports from CPARIS and CDMIS, of which we will go into more detail further on in this presentation. These reports will provide the consultant with data regarding the exceptional needs percentages for each contractor, showing if the set aside is met, as well as the percentage of children with an IEP or IFSP enrolled in the program. When the minimum set aside is not being met, the consultant will reach out to the contractor and provide technical assistance and support to help retain the minimum requirements. The technical assistance may include and is not limited to providing resources for individual counties, such as providing information on special education local plan areas, short for SELPAs, as well as connecting contractors with the CDE's Special Education Division, Regional Focus, Monitoring and Technical Assistance Consultant, short for FMTA or FMTA. The EDD is currently working with the cross-division team to develop a list of resources for each county that will support CSPP contractors with recruiting and enrolling children with exceptional needs. The ultimate goal of this technical assistance is to support contractors in meeting the set-aside requirements and to ensure that contractors have the information, tools, resources, and collaborations necessary for the children and families they serve to thrive. Next slide, please. Creating inclusive classrooms and providing the least restrictive environment. Children with exceptional needs attending CSPP must be educated in the least restrictive environment, LRE for short. That is, to the maximum extent appropriate. Individuals with exceptional needs must be educated with children who are non-disabled and special classes, separate schooling, or other removal of individuals with exceptional needs from the educational environment may only occur if the nature or severity of the disability is such that education in the regular classes with the use of supplementary aids and service cannot be achieved satisfactorily. In order to provide best practice for inclusive classrooms and least restrictive environments as intended with this new legislation, contractors must make every effort to equally distribute the enrollment of children with exceptional needs across and throughout their program, across all contracted counties, sites, and classrooms. The CDE will continuously be looking at program data in order to monitor that children with exceptional needs are being focused, or with exceptional needs are not being focused and served in selected counties, sites, or classrooms. Next slide, please. CSPP staff on individualized family service plan and individualized education program teams. Pursuant to the Individuals with Disabilities Education Act, IDEA, the IEP team is responsible for determining the placement of a child with a disability, taking into consideration the least restrictive environment provisions. The CSPP program directors should be aware that, among other team members, the IEP team must include not less than one regular education teacher if the child is or may be participating in the regular education environment. Therefore, a regular education teacher from the CSPP may be required to participate as a member of the child's IEP team. The CSPP program directors should be aware that for children with an IFSP, the IDEA or IDEA requires that the IFSP team to include, among other participants as appropriate, persons who will be providing early intervention services to the child or family. Thank you.
Thank you, Sandra. Good morning, everyone. My name is Joey Boyd, and I'm a fiscal analyst in the Early Education and Nutrition Fiscal Services Unit within the Fiscal and Administrative Services Division. I'm going to spend a few slides talking about the updates to the fiscal year 22-23 enrollment, attendance, and fiscal reports, how contractors can calculate their set-aside and determine the number of children needed to be enrolled to meet the set-aside, and how the CDE will reimburse contracts for their set-aside. First, effective July 1st, 2022, the adjustment factor for children with exceptional needs and children with severe disabilities increased to 2.4. As a result, the Child Development Provider Accounting Reporting Information System, CPARIS, enrollment, attendance, and fiscal report has been updated to reflect the new adjustment factors for fiscal year 22-23. There's no change to reporting, as contractors will continue to report subsidized children enrolled as exceptional needs or severely disabled under the applicable reporting categories. Reporting the child days of enrollment in these adjustment factor categories will provide additional reimbursement to the application of the adjustment factor. Next slide, please. Pursuant to Education Code Section 8208C, Section 1, in fiscal year 2022-23, CSPP contractors are required to set aside 5% of the funded enrollment for children with exceptional needs as defined in Ed Code Section 8205. For fiscal year 22-23, the 5% set aside will be calculated by multiplying the contract MRA by the full-time exceptional needs adjustment factor of 2.4 by 5%. So for example, a contractor has a CSPP contract MRA of $1 million. For fiscal year 22-23, $120,000 will be reserved to serve children with exceptional needs, which is the result of the following calculation. That $1 million MRA times the 2.4 adjustment factor times the 5% set aside equals the $120,000. Next slide, please. CSPP contractors are issued one annual CSPP contract that, upon approval, can be used to provide a combination of part-day and full-day CSPP services and can be used to provide services across multiple counties. ENFS has developed an exceptional needs funding enrollment calculator, which contractors can use as a tool to determine the number of children associated with the 5% set-aside requirement for this fiscal year. Contractors will identify the counties in which they plan to serve children with exceptional needs, the percentage associated with each county, and the percentage of exceptional needs enrollment they expect to have in their full day and or part-day programs. With this information, the exceptional needs funded enrollment calculator will calculate the number of children with exceptional needs, including children with severe disabilities, the contractor can enroll to fully earn the set-aside requirement. Throughout the fiscal year, if actual enrollment differs from the percentages originally entered in the exceptional needs funded enrollment calculator, the contractor should update the assumptions used in the calculator. Updating the calculator will provide a more accurate number of slots associated with the set-aside requirement. It is not a requirement to submit the funded enrollment calculator to CDE. The funded enrollment calculator is available on the ENFS website at https://www.cde.ca.gov/fg/aa/cd/. Next slide. To ensure funding is available to enroll children with exceptional needs within the required set-aside, contractors will be fully funded for the percentage of funded enrollment set aside pursuant to Ed Code Section 8208C, Section 2, subsection B. The CDE will advance the funding set aside for children with exceptional needs based on the normal apportionment schedule, regardless of whether the contractor is fully earning their set aside amount. The CDE will determine the extent to which contractors are earning their set aside amount based on the child days of enrollment reported within the exceptional needs and severely disabled adjustment factor categories. Contractors who are not fully earning the amount set aside to serve children with exceptional needs will receive a service level exemption credit, which allows the contractor to be reimbursed for identified expenses without meeting the service requirement. Next slide, please. I now want to go over a few examples of how the service level exemption credit will be calculated. The table here reflects how the service level exemption credit will be calculated when the contractor is projected to fully earn, partially earn, or have no earnings associated with the required set aside. In the following examples, the contractor has a daily reimbursement rate of $55.27 and $120,000 has been reserved to serve children with exceptional needs. The first example is a contractor fully earning the required 5% exceptional needs set aside. The first row reflects the MRA of $1 million. The second row is the required 5% set aside of $120,000. It's calculated, remember, by taking the MRA times the 2.4 adjustment factor times 5%. The third row shows 2171.1598 as the projected fiscal year exceptional needs severely disabled adjustment days of enrollment, which is data reported by the contractor and submitted in CPARIS through the enrollment, attendance, and fiscal report. The fourth row is the projected fiscal year exceptional needs severely disabled service earnings of $120,000, which is calculated by multiplying the exceptional needs severely disabled projected adjusted CDEs by the full day rate. In this example, the full day rate is $55.27. In this scenario, the contractor is fully earning the required set aside and will not require a service level exemption credit. The second example is a scenario where the contractor is only partially earning the required exceptional needs severely disabled 5% set aside. The contract MRA and exceptional needs severely disabled set aside remains the same as the first example. Based on the data reported by the contractor on the enrollment, attendance, and fiscal report, the projected fiscal year exceptional needs severely disabled adjustment days of enrollment is 1171.1598. Multiplying this by the full day rate of 55.27 shows that the contractor is projected to have 64,730 as the projected fiscal year exceptional needs severely disabled service earnings. So in this scenario, the contractor is projected to earn less than the required set aside and will receive a service level exemption credit of 55,270 for the fiscal year. In the last example, the contractor has the same contract MRA and exceptional needs severely disabled set aside. However, they are not serving any children with exceptional needs severely disabled and are projected to earn 0. In this scenario, the contractor would receive a service level exemption of 120,000 for the fiscal year, the full amount of the exceptional needs severely disabled required set aside. Next slide, please. The Child Development Provider Accounting and Reporting Information System, CPARS, contract earnings calculation has been updated to include the required set-aside amount, the earnings associated with the set-aside amount, and the service level exemption credit. Contractors will be able to use this information to track, monitor their earnings related to the set-aside amount throughout the fiscal year. And now I'll turn it over to Carly to go over some updates on 801A data reporting.
Thank you, Joey. So good morning, everyone. I will be sharing information about the Child Development Management Information System, or the CDMIS, and how it relates to Management Bulletin 2302. The CDMIS has implemented all programming changes related to children with exceptional needs as of the July 2022 CDD 801A report. The CDMIS has also updated the Child Has an IEP field to read Child Has an IEP or IFSP. If a child has either an IEP or IFSP, contractors must input yes in an electronic file or check the applicable box in manual input for this child to be reflected in the Child Has an IEP or IFSP count. This is not a new directive. When submitting the CDD 801A report, please ensure information related to the IEP and IFSP is as up to date as possible. As a reminder, when a child's status as a child with exceptional needs changes, contractors must change the Child Has an IEP or IFSP selection to reflect the new status. If a child with an IFSP does not qualify for an IEP, contractors must change this field to reflect the new status by inputting no or unchecking the field in the 801A. The 801A will be used to determine the number of children with exceptional needs currently enrolled in CSPP per contractor. Next slide, please. So in this section, I will review the CDMIS and where this field is located. So I'm going to go ahead and steal screen sharing. And then, okay, so this is the homepage of the CDMIS, and we know that it's been revamped, and we're planning on having a webinar upcoming to review these changes. But from the homepage, if you're doing manual input, you go to CDD 801A input/edit. And I'm just going to do this for January 2023. And then we'll be using our test agency. Okay. So in the manual input, you'll check out a family, and then this field is in the child section. If a child has an IEP or IFSP, you'll go ahead and check this box. And if this status changes, you'll just go ahead and uncheck it. And we will use this field in our data pools to determine current enrollment within your agency of children with exceptional needs. So can we go back to the main presentation? Thanks, Mai. And then next slide, please. So also beginning in fiscal year 22-23, data on meeting and filling the set aside for children with exceptional needs will be collected. All contractors must develop and implement an annual plan for its program self-evaluation process. Contractors must include information on how they were or were not able to meet the set-aside percentage of funded enrollment for children with exceptional needs through their fiscal year. If the set-aside was not met, the report must include information about conducted community outreach to special education partners in efforts to recruit additional children with exceptional needs into their programs. Next slide, please. And also, in order to collect data, the CDE will be implementing a SNAP survey to assist in determining whether the set-aside for funded enrollment is being met for children with exceptional needs. EED is planning to release the survey in September, on September 1st, 2023, and should be submitted back to EED by September 30th, 2023. The survey questions will be posted to the Inclusive Early Education Resources webpage in the coming weeks, and contractors will be notified when they are available to review. Again, the survey won't be available for responding until September, but your agency can begin gathering the data that will be included in the survey. I'll review the anticipated survey items to be included in the next slides. So part 1 will be contractor information and will include contact information for the person completing the survey, along with contractor legal name, vendor number, primary county and operational counties, and program director information. Part 2 of the survey will include funded enrollment information from July 1st, 2022 through June 30th, 2023. Per Education Code 8208 AE, funded enrollment means the number of subsidized children funded to be enrolled based on the maximum reimbursable amount, contract rate, inclusive of any adjustment factors, and approved program calendar by a California State Preschool Program contractor. These questions will include asking about the number of total children funded to be enrolled during fiscal year 2022-23 in total by agency and also by county. If your agency has multiple service counties, you will also need to know the breakdown by county, and you will also be asked to provide the total number of classrooms within your agency. Next slide, please. So part 3 will ask about the number of children with exceptional needs enrolled by your agency at the county, site, and classroom level from July 1st, 2022 to June 30th, 2023. Sites are facilities or centers that contain classrooms, and a classroom is defined as a group of children that have a lead teacher assigned at a unique time of day. For example, at one facility site, there could be 4 rooms with a lead teacher assigned to each room, but each teacher could have a morning and afternoon class and unique group of students. Thus, at this site, there would be 8 classrooms. Please respond with information regarding how many sites and classrooms served at least one child with exceptional needs. You will also need to know what % of children with exceptional needs were served for your contract during the fiscal year. Next slide, please. So part 4 will ask about the barriers faced in recruiting and enrolling children with exceptional needs. We will have multiple choice options, so you can select more than one barrier and also have a space to provide more specific information about the barriers your agency faced. It will then ask about the community outreach and referrals your agency made from July 1st, 2022 through June 30th, 2023. Community outreach choices include outreach to local regional centers, local early starts, your local SELPA, other outreach, and community outreach was not needed. If your agency met the set aside, we are also asking for a narrative response detailing how your agency was able to enroll children with exceptional needs. The last section in part 4 will ask about IEP referrals during the fiscal year, including how many children qualified for an IEP and how many children are still pending an assessment. Next slide, please. So part 5 will be optional. And this section will ask about technical assistance, and we will use this information to leverage existing resources and inform future technical assistance opportunities. We want to know what technical assistance would be most helpful for your agency related to serving children with exceptional needs. Some of our anticipated choices include best practices for community outreach and enrolling more children with exceptional needs, professional learning opportunities on instructional practices to support children with exceptional needs, creating inclusive classroom environments, including Universal Design for Learning, or UDL, developing partnerships between early learning and care providers and LEAs, tools or strategies for sharing information with the IEP team, facilitating transitions to TK and kindergarten, support for increasing parent engagement, collecting and reporting data on children with exceptional needs, and then as an other option where you can include information for an option not previously included. Finally, part 6 will include certification information and certifying that all the information submitted within the survey is as accurate as known. I'll now turn it back over to our moderator, Angela. Thank you.
Thank you so much, Carly. So the CD is planning on having some planning sessions capped at 100 to 150 participants each to get feedback for the CSPP regulation package, specifically on the set-aside and the waiver process. These sessions will be split up into small groups led by a CD facilitator. An email with more details and registration information will be sent out via the Early Education Division email distribution list. Next slide, please. Thank you. So now we're going to go over some resources for you. The Impact Inclusion Workgroup has created a new inclusive early education resource webpage, and it includes many different topics related to inclusion, such as screening, universal design for learning, pyramid model, and teacher pyramid, IEP information. There will be a link to the resource page in the management bulletin. https://www.cde.ca.gov/sp/IEERESOURCES.asp. These resources will be included in the management bulletin to assist with community outreach for children with exceptional needs. Regional centers provide and coordinate services and supports for individuals with development disabilities. Contractors should reach out to the local regional centers to share information on the availability of CSPP for children with exceptional needs. To find out more information regarding local regional centers, visit /. We need a bit.ly for that one because that is a super long link. And you'll also find that we have put these links in the chat for you, just so you know, but we do have to read them out loud. Thank you. Next slide, please, for our second page for resources. The Early Start program in California's early intervention program for infant and toddlers with disabilities and their families. Early Start services are available statewide and are provided in a coordinated family center system. For more information on family resources centers, visit https://family-center.gov/STARY-ESP/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center/family-center consortiums called Special Education Local Plan Areas, or SELPAs, to provide for all special education service needs for children residing within the regional boundaries. The CDE website lists all the SELPAs, regions, and the contact information at cde.cA.gov/SP/SE/CASELAPAS.ASP. All right, so remember, all of those links can be found on the slides that we will post along with the recording, and also you can have them in the chat as well if you need to go back to reference them. All right, so now it's almost about 11 o'clock, and it's time for us to get into the fun part of this webinar, which is our live Q&A. So I believe we have a couple questions. And as you know, if you have not put your Q&As or your questions, you can put them into the Q&A at the bottom, and we will do our best to answer as many questions as possible. And if we do not answer your questions, we can always take them back. So the first question I have is from Denise at 10:09. And her question was, any tips or big plans to streamline the process of getting early education children IEPs or IFSPs, giving permissions to allow our behavioral health consultants to provide the IFSPs. Right now, they have to go through the school district, who does not prioritize the early education age group and makes the process cumbersome for our families who are already struggling in other ways to thrive as a family. So I'm going to call on Katie to see if she is able to answer this question for us.
Angela, I believe that Katie was only available until 11.
I tried to get in there before 11 so she could answer that one. But of course, like I said, if we aren't able to answer these questions, we will take them back, and we are planning to make FAQs and get them out to you as soon as possible. So that might be one of those questions that we take back to our special education division and get some more information. All right.
Angela, Katie, sorry to interrupt you. Katie did provide an answer in the Q&A function. So if folks want to, essentially what it says is that there's specific timelines for referral and assessment outlined under the federal IDEA law and also in California Education Code that have requirements for children enrolled in preschool programs. And there's specific timelines that her answer lays out. So once a written referral for assessment has been received, the LEA has 15 days to complete a proposed assessment plan. And that once a parent consents to initial assessment, these determinations and an IEP meeting have to occur within 60 days based on education code. And there's some links on that she put in on the IEP process. And if there are concerns regarding an LEA's meeting the referral assessment timelines for preschool age children, you can reach out to your region's SELPA, and we have the list of SELPAs on our CDE webpage, and I'll put that link in the chat so everyone can access it. So, and you can also contact your regional FMTA or FMTA consultant, and that link I'm also placing in the chat. So those are some resources if you're having trouble around these timelines.
Thank you, Virginia, and thank you, Denise, for that question. I thought it was a high level one that we needed to address or talk about, as it is very important. So we're going to move on to our next question. The next question is from an anonymous attendee at 10:42. Family fees are not to be collected for any child that has an IEP and income eligibility. If a family whose income is higher than the maximum income on the family fee schedule will be changed the highest fee rate or charge the highest fee rate and collect it. And I'm going to call on Danielle or Jennifer to answer this one.
Thank you so much. Oh, Danielle came off camera. I can hand this off to Danielle.
Nope, sorry, I just thought you were going after me. So I was just gonna say all families are being charged family fees. Unless they're specifically exempted from statute, which children with exceptional needs are not, they are being charged family fees, unless of course they're in part day. So for full day state preschool, they will be charged family fees. And then if the family is over income, like you would use like any other state preschool full day family that is over income, you would just use the highest fee for that family size for a family that's over income off of the family fee chart. Did I answer all the parts of that question? I know there was multiple.
Yes.
Yes, okay.
You did.
There is a provision of the management bulletin if receiving CSPP services is part of the child's IEP, there is a provision around the LEA covering the family fee for that family if they're in full day state preschool.
Thank you, Danielle and Virginia. I'm going to move on to the next question unless anyone else had anything to add to that one. Okay, so the next question I have is from Matthew Tinsley at 10:18 a.m. The management bulletin states concentration enrollment for children with exceptional needs in specific counties, sites, or classrooms is not aligned with the intent of the new requirement. How concentrated is too concentrated? What is best practice? So I'm going to call on Jennifer for this one.
Thank you so much, Angela. Yes, we are encouraging contractors to spread out their enrollment of children with exceptional needs as much as they can and not to concentrate all of your enrollment in one county or one site or one classroom. We are in conversations with special education about answering this question specifically. So I'm sorry I cannot share more information than that. Thank you so much for bringing it forward. We have heard this question and we are in talks about it. Thanks, Angela.
All right, thank you, Jennifer. The next question is from Eric Summerfield at 10:21 a.m. What is considered a copy of the IEP or IFSP? Is the summary enough? Danielle, I'm going to call on you because I remember we were discussing this earlier in conversation together.
Well, hello, Angela. So this is something that hasn't changed. So this is currently still what's required in regulation for children with IEPs. So the actual documentation part of the IEP hasn't changed of what you need to collect. And I think for the most part, if you just collect the at a glance page in an IEP, it will contain all the information that's required by regulation. I can look to find the exact regulation and pull the exact language, but I don't want to misspeak off the top of my head on like the exact language of what's required. So I will put it in the chat when I find the exact regulation number and the requirements.
Thank you, Danielle. That was very helpful. And of course, if you need to provide a follow-up question, you can always put it back into the questions and we can see if we can get those answered if you have any follow-up questions. I know it's hard because during office hours, we often have a back and forth conversation with attendees, but for webinars, we just take the questions and give the answers. So our next question is from Nonis Tendi at 10:27 a.m. Would income reported by the parent on the application for the program be significant or sufficient as the self-certification for income, or should we ask for a separate form or letter? And I'm going to call on Cassandra for this question. So I don't know if Cassandra is having trouble unmuting.
I think I can address this, Angela. So this is one thing that we'll be addressing in an FAQ. So We know that we don't have everything for this webinar, but just want to let you know that all of the questions that we're not fully ready to answer verbally today, we will be releasing FAQs. We'll be posting them on our inclusion resources page. And so that you'll have access to them. And we will also be, as others have mentioned, having an office hour where you can ask additional questions. So don't worry if we don't have the answer to your question today. We will be working on those answers. This is a very complicated area, and we want to be giving you all guidance.
Thank you, Virginia. All right, so the next question I have is from S. Romero at 10:38 a.m. Can we claim CSPP Part Day children that their ADA has been claimed by the district special ed department? And I think I'm going to call on Corey to see if she can assist us with this question or know someone else that can.
Can you say the question again?
Yes. Can we claim CSPP Part Day children that their ADA has been claimed by the district special ed department?
So this is one that we are aware of. We don't have the answer yet, unfortunately, but we are going to include it on an FAQ that eventually gets posted.
Perfect. Thank you, Corey. And I know like we're going through all these questions, but just so you know that a lot of the questions have already been answered. So I think we're at 120 questions have been answered by our panelists here today. So make sure you go in there and you look over those answers to those questions as well. I'm going off the list that are kind of more difficult questions to answer live so that we can get you a little more information, or at least let you know that we are addressing those hard questions the best we can, or we're taking them back. So the next question I have here is from Diana Kahn at 10:34. If a family pays private tuition, high income, and the child has an IEP, does that mean they are still eligible to be in CSPP and no family fee for them? Will this family count as part of the percentages for special needs? I'm going to call on Virginia for this one.
Perfect. Thanks so much, Angela. So there are a lot of pieces of this question. So I want to sort of start by reminding everyone what we sort of shared in Management Bulletin 2301 and also is emphasized in this Management Bulletin. So children with disabilities or children with exceptional needs, as they're specifically defined in statute, so having the active IEP or active IFSP, are categorically eligible for state preschool. So what that means is that they do not need to be below 100% of SMI in terms of their family income. They can qualify if their incomes are over. Now, the way this works is if the set aside has space in it, if you set aside this year 5% of your funded enrollment, next year 7.5% of your funded enrollment, and the year after 10% of your funded enrollment, if you set aside those spaces and you have openings essentially within that set aside, they can enroll in the set aside. It's the lowest income first. If your set aside is full, then they're prioritized under the priorities that are listed in Management Bulletin 2301. So if their income is below 100% of SMI, they would come in second priority. If their income is over 100% of SMI, they would come later down your sort of priority list, but they can still be enrolled. And specific things around that priority order are addressed both in Management Bulletin 2301 and 2302. So what this means is that you can enroll a family over income in state preschool if the child has an active IEP or an active IFSP. They would pay a fee unless there was the provision, unless they were in Part Day, or unless there was a provision that it was part of their IEP, in which case the LEA would cover it. And so yes, if there's space in the set aside, they can count to the set aside. But if your set aside is full, then they would enroll sort of in the normal priority order outside of the set aside. So I know that there was a question, there was this question, there was another question from Rodique that sort of was around the same area. So maybe I'll address that one as well. So Rodique's question was, we have students in our CSPP classes with IEPs for speech. Do we need to report them under exceptional needs or that they qualified under income? And I think that there are a number of questions that sort of get at, like, do you have to report them under income or exceptional needs? As a contractor, you're required to set aside a certain portion of your contract to serve children with disabilities. And so there is, you know, while there's not a requirement that you fill the set aside this year, we really sort of want contractors to be moving to fill the set aside, because by 2026, you will be expected to fill it or get a waiver from us for not having it filled. And so really, contractors should think about how they'll be working to fill the set aside, not just set it aside, but fill it with children. And so if you have a child with an IEP and you have space in the set aside, it may be beneficial to enroll the child, you know, to enroll that child in your set aside, so you're filling your set aside, if that makes sense. So happy to, I'm sure there are probably a lot of follow-up questions from that, but, and I will also sort of, Jennifer or anyone else, if there's anything I missed, feel free to add on.
All right, thank you, Virginia. I know those were back-to-back questions, but those were great ones. And I think the next one I have is also yours, Virginia. This one is, I think it's from Lori Ballesteros, and it was at 10:49 a.m. What happens when you do not fulfill the set aside percentage? Currently, we have a child with an IEP, but family is above income. So with that, what has been discussed when we actually are not fulfilling the percentage? We do not have any other children, and they will be moving on to kindergarten in the fall. So concerned if no other children enroll with IEPs in the future, how does that affect our contract?
Great question, Lorelei. So there are a couple of pieces of this. So first of all, the requirement for this year is that you set aside 5% of your funded enrollment to enroll children with disabilities or children with exceptional needs, same children, if they want to enroll in your program. Now, part of this, the reason for this is that sometimes when children are transitioning from an IFSP to an IEP in the middle of the year, the goal is that there would be a spot ready that could take them. So you may find that in your area, as children are transitioning from having an IFSP when they're younger than 3 to having an IEP, that you'll have children that want to enroll in state preschool mid-year. And if you have space in your set aside, then you can do that. So just a piece about that. Next year, you're also, the requirement is that you set aside 7.5% of your funded enrollment, so starting in July. The year after, there's the requirement goes to 10%, and that's the first year that essentially this language about filling the set aside comes, but there's still no penalty if you're not filling it. It's really sort of, we'll be looking at data, we'll be reaching out, we'll be trying to see how, you know, what your barriers are. As Carly mentioned, we'll be doing a survey to better understand some of the issues that you may be experiencing around enrolling children with disabilities. And by 2026, if you're not meeting it at that point, you can apply for a waiver. Now, as others have mentioned, we don't have the waiver process described yet. That's a couple years out. We will be starting to figure out what that will look like, and that's where those input sessions that the others mentioned will come into play, so we can get your input as we think about what that waiver process will look like. So if you're not meeting the set aside this year, and if you should be setting aside the funds, but if you're not filling it, you have a couple of years to get to that point. And the management bulletin has a lot of resources to help you think about how you can go about recruiting children with disabilities into your program. There are also specific provisions that say if you aren't filling your set aside, you need to be doing outreach. You can't just be waiting for children to come. You need to be reaching out and collaborating with local special education partners to figure out how you can fill the set aside. And you're being funded to have the set aside, whether you have children in the set aside or not. So if it's empty, you should have the resources in your contract to support that outreach.
Thank you, Virginia. All right, so our next question is from Elizabeth Robinson at 11:06 a.m. Why not just add children with disabilities to the priority list? Let me repeat that. Why not just add children with disabilities to the priority list? Holding spots in this manner does not allow for us to serve our CPS and foster referrals. I'm going to call on Danielle.
Hi, Angela. I think part of this is that would be a question that should be probably directed towards the legislature and your representatives. And this is not something that CDE has put. This is a law that came into place, and we are implementing the law. I think if you have additional questions for how that came to be, unless Virginia has something else to add on the policy side, I think that the answer is it came by law. CDE is just implementing. This is not something that CDE has made the decision on, so we aren't the ones that would be able to answer that question necessarily. But we appreciate the question.
Thank you. I have a question. I think it's a follow-up question to a question that Kim McMillan had already responded to. It's from Sarah Serrano at 11:11 a.m. and it says, can you please clarify that Kim McMillan's response is correct to Jenny Sanata's question at 11:04? So you're saying school districts can force families to move the child to the school from their CBO by determining the LRE placement. And I'm going to call on Kim McMillan.
Thank you, Angela. To clarify my response to the first question, I just want to remind everybody that the placement for a child's least restrictive environment is determined by the IEP team. The IEP team includes the child's current teacher as well as the parent. I'm not saying that they would be forcing a decision, but it is the IEP team that does determine what is the least restrictive environment and the best placement for the child.
And to add to that, the CSPP teacher can be a part of the IEP team. So that is included in the management bulletin from IDEA that Sandra presented. So we want you to work with the parent and advocate to get yourself on the IEP team to help determine that placement that Kim talked about. Thank you, Angela. Thank you, Kim.
All right. There's a lot of questions, so I'm just letting you know I'm kind of like going through and just picking questions as I see them that are popping up multiple times. And of course, like I said, we're going to take these questions back, even if they're unanswered, but we are answering as many questions as we possibly can. We have just a little more time here, so I think we're going to have to say about 2 more questions. I think we can fit that in. So I have a question from an anonymous attendee at 10:51 a.m. What if the child no longer has an IEP and is not being counted in the set aside? Since we cannot terminate their service for the 24-month, how will we report them in the A01A if their income is too high? And I think this is maybe
This
Danielle
is Carly.
or Carly.
I think I can answer this, and this should have been updated in the CDMIS in the 801A. So if you're marking that the child has an IEP or IFSP, you should be able to input that income. And if you're not able to, please reach out to the CDMIS support team, and we can always be reached at cdmis@cde.ca.gov. Yep, so please feel free to bring that question to us directly too.
Thank you, Carly. Sorry about that. All right, so I think we have time for one more question, and then we're going to be closing out. Here is one more question. Sorry, there is so many wonderful questions. I have to say, like, I'm so impressed with the amount of people that are here today and all the wonderful questions. And we really appreciate you guys taking the time out of the day to like go over all these questions with us and being patient with us, especially on the questions we don't have answers for. All right, so I see anonymous attendee. Will there be expansion opportunities to help meet the need demand? We are full and have no spaces and are above the 5% CWD threshold for this year, with increasing numbers of children qualifying for IEPs. How can we help meet this need for high quality early childhood programs with LRE? So that's a hard one. I think I'm going to call on Jennifer.
Thanks so much, Angela. I'm actually going to pass this question on to Corey Kahn.
Okay.
Can you repeat the question again? I'm sorry.
Oh, it's okay. It's a long one. I want to make sure you get there. So the question was for an anonymous attendee, and it says, will there be expansion opportunities to help meet the need/demand? We are full and have no spaces and are above the 5% CWD threshold for this year. With increasing number of children qualified for IEPs, how can we help meet this need for high quality early education programs with LRE?
So this has to do with expansion. So currently, there was an RFA for expansion that was released by EED last year, I think, or it was awarded this year, released last year. So there was some excess funding during that round. So we received 130 million related to expansion last year. There was unused funding, so I believe that EED will be releasing a subsequent RFA. Steve or Virginia, I don't know if you want to jump on to further any of that.
Yeah, I'm sorry, Corey, I was thinking this question was slightly different than it was, which is why we called on you. So yes, we will be releasing another RFA. We have about 29 million available in funds that by their nature can only go to LEAs. However, if you are not an LEA and are interested in expansion funds, we do want to remind folks that you can work with an LEA in your area to have them be essentially the official contractor, but then subcontract it to you as a community-based organization. So even though the funds cannot by law be awarded from CDE to community-based organizations, you can work it out at the local level so you get access to these funds. So that's one way that we'll see some expansion as well.
All right, well, thank you very much. And of course, we're, like I said before, and I'm going to say this again, because we will be taking all of these questions back to us, even the ones we were unable to answer today. I do want to mention that we answered over 149 questions, but I think I'm going to pass it over to Virginia to close us out for today.
Wow. Thank you so much, everyone. We really cannot say enough about the complexity of these new rules and also how excited we are about this important opportunity to all work together to improve inclusion for children with disabilities in our state. We are so excited about all the possibilities that this presents and appreciate the recognition that with these new responsibilities, the new funding and the higher adjustment factor was so critical there. So we really want to thank you for everything that you're doing. We want to thank you for all of your questions. They help us do our job better. And we are so excited to hear more of them. We'll be sending out an email once we can figure out some dates internally that will have some office hours. So any questions that you still have, we will be able to talk through in office hours. We will also be working on those FAQs I mentioned, and we'll be working as quickly as possible to transcribe all of the text, all of our speech in this webinar so that we can post the recording. But know that we've been going for an hour and a half, so that does take a little bit. It's not immediate. I also really want to thank the team that worked so hard on this management bulletin and this webinar. So thank you, everyone. We're so excited to start this and continue this journey toward inclusion with all of you, and we'll see you next time.